I want to pick apart arthritis because obviously that's a huge topic in this age demographic. We've mentioned it here a couple of times. I'd like you to talk a little bit about, because you mentioned running doesn't cause arthritis, probably pickleball. These sports aren't causing it. Let's make a distinction here because we have osteoarthritis and rheumatoid arthritis. Maybe talk a little bit about that and their role in it, I guess maybe the how one gets arthritis and then how one might control arthritis.
Sure. So osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis is an autoimmune condition, so you can get a blood test and kind of rule in or out whether that's occurring. Osteoarthritis, osteo means bone, arth means joint, itis means inflammation. So it's a condition affecting the joint surface. It can happen in any joint, but when we're talking about the knee, it's the joint surface where the end of the thigh bone reaches the top of the shin bone or the tibiofemoral joint. Both of those surfaces of bone are covered with a substance called cartilage, which provides shock absorption. And when it's healthy, it's smooth and there's no friction in there. It's like slicker than ice on ice. There's also the joint between your kneecap and the groove on the end of the thigh bone. That's the patellofemoral joint. And that too can be, the cartilage there can be affected as well. So when cartilage is strong, on a molecular level, the cells of cartilage bind water very tightly and the surface is firm. So strong cartilage is hard or firm cartilage. Cartilage is kind of on a continuum where it's not like you have healthy, strong cartilage over here and broken, abused, arthritic cartilage over there. There's a continuum, and as cartilage weakens, it's getting softer. So chondromalacia is on that continuum. Chondro means cartilage, malacia means softening, and softer cartilage means the cartilage cells aren't holding on to water molecules as tightly. And that's a weaker type of cartilage. When cartilage is weaker, an activity that, might seem rather benign or that you did, 10, 12 more years ago that you enjoyed doing may put pressure on the cartilage inside your knee to the point where microscopic cells of the cartilage shear off. And you may not feel it right in that moment. So you may go for a short run, or you may go do some exercises at the gym, or you may go play a short game of pickleball, and you may not feel it while it's happening because there's not nerve supply that goes to the cartilage. What happens is those cells float around inside your knee in this joint fluid that's in there, and eventually those microscopic cells of cartilage contact the joint lining, and the joint lining does have nerve supply. And then people start to feel like an achy sensation or maybe a light burning or a soreness, and it's delayed. So it sometimes it can be confusing. Like, well, I felt fine when I was playing, or I felt fine when I was exercising. Why later tonight is this bothering me? Or the next day even, is this bothering me? If that happens frequently enough, then degeneration happens, and that's when x-rays can start to change and that type of thing.